بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. I'm Bahauddin Ahmed Hassan Tabeel, PhD student studying Human Resource Management in Faculty of Leadership and Management in USIM University. Inshallah, now I will discuss my paper entitled with The Effect of Transformational Leadership and Motivation on Work-Life Balance Among Nurses in Gaza Strip, Palestine. Now, I will share and present the paper in the 5th National Conference on Humanities and Social Science 2021. I would like to thank the organizing committee to give me the opportunity to participate in the conference. In addition, I extend my sincere thanks to my supervisor, Dr. Khairun Nizam, for his direction and advices. Okay, now this is the contents. I will start with introduction, research problem, research questions, research aim, research objectives, model, and research significance. This is the introduction. Work-life balance, considered as a basic and an essential element of quality of work life. In short, the notion of work-life balance is used to describe an appropriate equilibrium between career and private life to ensure employee dignity. Motivation is a management technique that maintains and directs employees' performance to achieve the planned organizational goals. Intrinsic and extrinsic motivation are the most common types of motivation. Transformational leadership is considered as a human approach that supports management and followers to increase efficiency, create a desire to do their work in the best way, and build up the mutual respect and trust between leaders and followers, besides admiration and loyalty. Work-life balance has a wide frame and important interest at public government's discourse level and became a trend and a big priority for various administrations, especially nursing administration and healthcare sector. Nursing is a leading profession in Palestinian Ministry of Health and have the biggest proportion among other healthcare workers, which constitutes 42%. So it must concentrate on those target population to assure quality improvement in all MOH institutions. In this research, the nursing staff was chosen because it is a sensitive profession that affects patient life if it is not given the important consideration that is supposed to be. Nursing profession provides most of care for the patient during 24 hours, 7 days a week, and contacts with patients considerable time in relation to other medical professions. So distinctive working life balance for nursing staff will effectively impact on healthcare system. Okay, now I will discuss the research problem. Work is dispensable in our lives as everyone needs to do work to survive among complex life requirements. Dozens of researches and reports classified nurses' work as a difficult and arduous profession with occupational stress such as long working hours, death of patient, shift work, sleep disturbance, and prone to health hazards such as exposure to infectious disease, biological hazards, and psychological demands, where they provide the highest percentage of patient care and exposed to high work pressure and required working with patients 24 hours a day, 7 days a week compared with other jobs in hospitals. Lack of nursing benefits can lead to unfavorable results for health system. Therefore, working-life balance had become one of the major concerns among both the nurses and nursing manager. Moreover, when working-life balance is lacking, nursing staff typically experience dissatisfaction. Then they became the first enemy against hospital goals, owing to nurses' innumerable challenges and difficulties while they fulfilling their professional and personal responsibilities. Henceforth, the focus of nursing manager towards providing working-life balance to their staff becomes significant. This is the research questions. First, what is the impact of transformational leadership in nurses' working-life balance? Second, is there a direct relationship between transformational leadership and motivation? Third, is there a direct relationship between motivation and nurses' work-life balance? Does motivation moderate the relationship between transformational leadership and nurses' work-life balance? Fifth, is there a direct relationship between motivation and the nurses' work-life balance? Sixth, is there a moderate role from motivation in improving nurses' work-life balance? This is the research aim. The aim of this study is to examine and understand the relationship between transformational leadership role as a predictor of nurses' working-life balance through motivation as a moderator among nurses in Gaza Strip governmental hospitals. The research objectives are 5. To begin, number 1, to access the level of job transformational leadership, motivation, and work-life balance among nurses. Number 2, to explore the impact of transformational leadership on nurses' work-life balance. Number 3, to identify the relationship between transformational leadership, motivation, and work-life balance. Number 4, to determine the factors that might increase the level of nurses' work-life balance. Number 5, to obtain demographic information about the employed nurses and identify demographic factors which could influence nurses' work-life balance. This is the model. We have IV and DV and moderator. The independent variable is the transformational leadership. The dependent variable is work-life balance. The moderator is motivation. The research significance are 6. Number 1, the research results may help nursing staff to recognize the work-life challenges and develop strategies to minimize the challenges. Number 2, the research results may help the nursing managers and the nurses staff to realize obligations and responsibilities toward good working-life balance among nurses of MOH hospitals. Number 3, the research results may help the policymakers to find ways to curb the present undesirable situation and to understand pertinent work-life issue in regards to MOH hospitals. The research results may add on the existing literature on the implementation of nurses' transformational leadership and work-life measures in nursing staff. Number 5, the research results may help to revive MOH hospitals and used as a guide for development of regulations and practical strategies to enhance nurses' work-life balance. Number 6, the research results may help to open new vistas for future researches. Finally, the conclusion. This research is under processing and development. The result of this research may provide new evidence that transformational leadership can help resolve existing complex working-life balance among nurses with the help of generalized results for the rest of health service delivery staff in MOH in Gaza Strip. This result is expected to be used as a base or reference for parties involved in observing and increasing the development of the healthcare sector. I conclude my speech. Wassalamu alaikum wa rahmatullah.